Louison.
So rest day provisions and work hour limits for public healthcare workers are governed by the Employment Act. For those healthcare workers that are not covered by the Employment Act, their rest day provisions and work hour limits are set up in the public healthcare cluster's employment contracts. COVID-19 has stretched our healthcare resources and placed a heavy burden on our healthcare staff. All our public healthcare workers have been working doubly hard during this time of crisis. Whenever there is essential and urgent need that requires overtime work, employers will accord overtime pay as required by Section 38 of the Act. We urge cooperation and understanding from everyone as the hospitals reduce non-urgent and non-life-threatening care treatments to manage the current workload, decant those who need less intensive care to community treatment facilities, and curtail visitations to hospitals. Public healthcare clusters have allowed staff to rest and recharge by taking days off, including taking annual leave whenever possible. MOH is also supporting them by doing whatever we can and stepping up on vaccination. We hope to turn the corner soon from this current wave of COVID-19 infections. Thank you, sir.
Mr. Louison.
Thank you, sir. I thank SMS for the reply. Could I just check specifically whether MOH has studied this issue further? I mean, in terms of overtime hours, how much are the nurses working overtime, the doctors as well, during the past few months or 2 years in this pandemic? Two, I think really is a manpower crunch. So is MOH also studying the resignation rate, especially amongst the experienced healthcare workers who I understand are leaving more as compared to the junior staff? And also, what is MOH doing to try and retain these workers? Thank you.
I thank the member for his concern on the workload of our healthcare workers. As I said, this is a crisis of a generation, and it's a truth that actually many of our healthcare workers are going above and beyond their call of duty, extended hours, especially also even in the primary care sector, our GPs as well. But this is their commitment to actually respond to the crisis and pulling their weight to make sure they become a strong last line of defense for our safety and our health. In MOH's COS in the next few days, we will be giving a fuller response on some of the strategy that MOH will look at to support our healthcare staff and also to look at boosting our manpower resources over the coming decade. So I hope the member will give us time and we will share more in details in our coming COS. Thank you, sir.